Hi everyone, it's Kathleen. I'm back. I'm going to talk right now about stress management, and it's a really, really big topic these days. I'm sure that we've all been seeing a lot of this information on TV and on the websites, but we're going to talk about managing in the time of uncertainty. I'll talk about some self-care and stress reduction ideas and tips as it's related, especially to this time right now and thalassemia. So it's really important to think of things a little bit bigger picture. So if you Google, stress reduction tips or ways to reduce stress, you'll usually get like a lot of lists of things. It's all the basics like, good nutrition and make sure you exercise and get together with friends, plan a vacation, go shopping, like all these things that we just really can't do anymore. Although I guess we're getting out a little bit more, but still certainly not like we were before. So we can't do a lot of those things. So I thought I'd put this together really to kind of try to shift perspective. So I'm going to talk about tools that we all have. They're in us, and we can use them once we kind of build them to be able to, like I said, shift our perspective, look at things differently so we're able to manage stress and do something with it, hopefully reduce the negative stress. So it's really important to look at what we can control. Like what is it that I can control in my life, and control it. Do something about it, manage it, make it work for you. There's going to be plenty of things that we can't control. So those things that we can't control, it's really good to accept them. You can't control it, but accept that you have to go for a transfusion, right? You can't change that. Maybe you can change the day, possibly, and move around the timing, but ultimately you must go for your transfusion. So accepting it is the first step to making it all happen. And then you're going to manage it. So that's a really important thing to kind of think of once you start, getting stressed or maybe a little bit overwhelmed. Self-awareness is a really interesting concept. It's the ability to really understand yourself and understand your needs. So the more I understand myself and the more I understand my needs, the better I can manage in uncertain times, right? Because I will know how much I can handle of staying by myself. When do I need to really reach out and do a Zoom call? When do I need to connect with, let's say, Cooley's anemia? How much can I handle of eating of the same foods that I'm eating, or all the things that are going on, while we were sheltering in place and as we're kind of moving out. How much support do I need? Everyone's different. Some people need a very little amount of support or socialization. Some people need a lot, and some people need just a little bit in between. So knowing yourself really, really helps. Knowing yourself and having good self-awareness also helps with overwhelm. So if we get overwhelmed, that usually leads to poor management of health. And with thalassemia, we know how important it is to follow the prescribed treatment. Gratitude is getting a lot of attention these days, and this is another very, very helpful concept. And the more you practice it, the better you get at it. All of these things are free. Most of the things I'm mentioning today are free. They're all things that you can develop to help you shift perspective. So the gratitude is the quality of being thankful for something, and it has an amazing effect on your quality of life. So if you can realize what you have, no matter what it is, and I believe everybody can find something that they have that they're thankful for, whether it's just getting up every day and thinking, I don't have a fever, or getting up every day, feeling like I've got choices today, I'm not somewhere where there's a lot of difficult things going on. And being thankful for that. It's a very, very, very powerful tool. There's research that shows that it can improve health and it can lead to greater happiness, which is what we all want. And that all leads to like a better brain chemistry, which helps us to feel better. So something really interesting is that there's two psychologists, Dr. Robert A. Emmons of the University of California, Davis, and Dr. Michael E. McAuliffe of the University of Miami, and they've done much of research on gratitude. So in one study, they asked all participants to write a few sentences each week, focusing on particular topics. One group wrote about things they were grateful for that had occurred during the week. A second group wrote about daily irritations or things that had displeased them. And the third group wrote about events that had affected them, with no emphasis on them being positive or negative. After 10 weeks, those who wrote about gratitude were more optimistic and felt better about their lives. Surprisingly, they also exercised more and had fewer visits to physicians than those who focused on sources of aggravation. So I think that's pretty powerful to think about. And it really makes sense to me because I think about in the work that I do, it's all about doing things to think about yourself and the way you think and how you can alter that way of thinking to change your emotions, right? It's all about like your brain chemistry, and that's called cognitive restructuring. So what they were doing was really thinking about things that were pleasant, helpful, and that generates that really good brain chemistry. So in cognitive restructuring, if somebody says to me, oh my gosh, I just can't take it anymore, there's nothing good that's going to happen as a result of whatever, then I may stop and say, well, there has to be something good that's going on right now. You know, it's kind of irrational to say that there's nothing that's good that's happening right now. And I really believe everyone can find something. So you can use statistics to kind of change that way of thinking. You know, the person might go, okay, that's true. I guess right now I'm making a really good dinner and I'm really happy about that. That is something that's good in my life. We have to focus on what we have. And once we do that, it does lift our emotions. And guess what happens when you lift your emotions? Behavior follows. You know, you're going to make a better choice. You're going to do things that are better for you if your emotions are in a more positive way. So this all goes to the think, feel, and behave. I call it the cognitive triad. So the way I think has a tremendous effect on how I feel, my emotions, and the way I act, my behavior. And I think of this a lot in terms of adherence with the chelation therapy. So the behavior would be adherence to treatment, right? Adherence to chelation. If I'm thinking that, why should I take my medicine? It's just not going to change anything. It's just not going to work. My feeling is going to be one of not so motivated and a little bit down, or even a lot down. And the behavior that's going to follow is probably going to be of a lower adherence to treatment. But if I can change that thought to, you know, my doctor said that it's really going to help me. It's going to be what makes my life that I can do all the things I want to do and have this really nice quality of life if I chelate and get my iron out. That's a more positive, and actually it's a more rational thought because it's true. That is what the doctors say, and we have tremendous evidence showing that. Therefore, it'll make me feel better, my emotion will be boosted, and my behavior will be one of chelation. And hopefully that behavior is going to be a habitual behavior of chelation. The best way to be adherent to treatment is to really make it part of a habit in your life. The power of habit, there we go. Habit is very, very powerful. And if you don't have a habit in place that's good, you know, start a new one. You can always press the button and start and restart the next day. Habits, the reason why they're so effective is that they become automatic. If I have a habit of getting up, having my coffee, and taking my dog for a walk every morning, it happens. It just automatically happens. Did I come to this earth with that happening and it was automatic? No. I had to set a point that I wanted it to be that way. And then once I did it, which it says it usually takes like 14 days, maybe 14 to 21 days to like really change a habit. then it's kind of in place, and then it becomes automatic. Just like Kia and Urania said earlier in the kids session, if you were there, being present is an amazing way to reduce stress. So being present means I'm not thinking and ruminating about the past. I'm not saying, oh my gosh, why did I say that at that party? Oh, and really kind of driving myself crazy. And it's not anticipatory anxiety or thinking about the future of what's going to happen that we have no idea, and there's so many unknowns. It's really being in the here and now. I'm here, I'm talking to you, I'm at my computer, I'm at my home, and this is where I'm at, and I'm just thinking about this experience. Being present can really help with stress and actually can really reduce depression and anxiety because of all those factors I just listed. You're right here. I actually just felt my sense of calmness increase because I'm thinking about just being present and not being in all these different places. It's very hard these days when we're multitasking to be present, but it really, really helps. It helps reduce stress quite a bit. Mindfulness. So mindfulness is another tool that Kia and Urania spoke about too. And they did a little exercise. And mindfulness is the process of getting yourself to being really relaxed and being present. Mindfulness comes from a really good sense of yourself. It comes from a good sense of breathing, relaxing your shoulders, relaxing your muscles, and calming your nervous system. So many times when I'm working with clients and we're trying to reduce stress and reduce anxiety, I talk about two things. One is you first have to calm your nervous system. So to make really good choices, calming your nervous system is the first thing to do, because if you don't calm your nervous system, you're in kind of like a frenetic kind of state. After you calm your nervous system, you can then use some of the CBT, the thinking, feeling, acting intervention, and you'll probably make better choices. If you are calmer, you're probably going to manage transfusion day a little bit better. You're going to be more likely to be adherent to treatments and more likely to see all of the possibilities in life, rather than if you're feeling tremendously anxious or even depressed or more in that negative emotional state. Acceptance is a very, very, very important concept, and it's another one along with mindfulness and gratitude that's gotten a lot of, I say press, because you just see it almost everywhere. So many believe that to change a behavior or to make a behavior happen, you have to accept it first. And I think that that's very true. And I definitely see it a lot in thalassemia. In order to really take control of your treatment, you have to accept that you need to do it. You have to accept that you have thalassemia. You have to accept that you're responsible for it, and accept what's needed in order to do it. If I'm going to the hospital and there's a difficult person there who's always at the front desk. I hear a lot of stories of like these difficult people at different places within, it could be at the front desk in the hematology clinic, or maybe right when you come into the hospital. If I don't accept that this is the way this person is, right, and then that person will just continue to make me really upset, and no change is going to happen probably. But if I accept that this is the way she is, I'll have a less reaction towards that person, because I've just accepted it as so. This is the way the person is. So acceptance can be very powerful. If you need to lose weight, accept that that's what you need to do, and then carry on. Many times this is really good with if you don't get along with somebody. Sometimes we don't want to face the fact that we don't get along with somebody, or we fight, or we have differences. But accepting that it just is sometimes can really move you to make that change. You're not in denial. Denial is really the opposite of acceptance. So what can make us feel out of control? And how do these things make us feel? Once again, it's so important to slow down, use the breathing techniques, be self-aware, and going back to what the researchers were talking about with the gratitude, stop and perhaps even do some writing, do some journaling about what you're feeling, especially right now with all of the uncertainty coming up in the fall, in particular with schools opening, or perhaps with your job opening up again. Being able to internalize it and really feel and understand what's happening. All these things that can make us feel out of control, we need to be mindful of. If it is media coverage, which media coverage does, and it's different for everybody, it's all an individualized process. Decide how much you are going to use. Decide how much you'll put on. Decide how much you'll read. That's all up to you, but you have to be really self-aware and mindful of it. Everyone's different. I need a good amount of media coverage just because I like to be on top of things and know. I have family members who can't look at it at all. And for me, it depends on the different types, but I just know that about myself. So being mindful about media coverage. Fears of contamination. I'm hearing a lot of that when I'm talking to all of you. It is scary. There are the fears. A lot of that we don't have a lot of control over, but we also have a good amount of control over it. We've got the masks and wearing gloves and using disinfectants and social distancing. There are quite a few tools that are out now that quite frankly weren't there like in March and April. So that can give us a tremendous amount of control. Asking questions, communicating, educating yourself, that can help with that. The stress, if you're still working, if you're still having to go into work, or if you're about to go back to work, trying to figure out like who you can communicate with, or how to communicate with your employer. That can be very stressful. Back to school is probably the top one, whether it's college or whether you're teaching, you're a teacher, or whether you have children. That is the big question mark right now. And then even if decisions are made that in your district that your kids are going back, what's it going to be like? And how much do you agree with that? And how are you going to set up your systems? So, just really, really be present, take the information in, communicate really well with you and your family, and you'll make the best decision that's for you. This is an election year. Election years are stressful. We have a lot coming up in the fall, so trying to take as much control over that as possible. Ralph and Danielle and Michelle did a great job talking about finances and the things that you can do. And Ralph talked about, this is just a really healthy way to look at money and put things in place. I think that can never, it's never too late to do things like that. And I think if we realize that we should have done things before, we can still do them. So getting prepared for when difficulties happen financially can be really a sense of control that you feel. We can put a certain amount of control around finances. Knowing that there's resources out there to help also gives us a really good sense of control. I just had a situation, not going to, obviously out of confidentiality, say any particulars about this situation or to identify, but there's a situation where I had a phone call from a parent who was in need of resources, or he would have been evicted. It was, somewhere in America, because I cover the nation with thalassemia. And so I did a couple of phone calls to different places, a lawyer and this and that. And then I went directly to the social worker at this person's hospital, and she had resources there. It's a foundation. She made a phone call to the foundation. They were able to give money to supplement the rent, and they were able to pay for some of their medical bills. So that is a feeling of control, knowing that there are places like that you can go, but you have to have those skills, and you have to know, to go to the right people. Being in close quarters with family has been very hard. So using communication skills to tell people when, maybe they're in your space a little bit too much or how much space you really need. Using your environment and really managing your environment well. Um, Knowing how much isolation you need and knowing that feeling isolated for extended periods of time is probably what's making you feel kind of yucky. So reaching out to friends in the way you can, perhaps talking to them through, the backyard or on the phone or through a video platform is going to be definitely better than not. Definitely worries about the blood shortage. Thank goodness that's going well. I think everyone's getting blood for sure. Um, Going to the hospital and getting a temperature check. And a lot of times I'm hearing they're putting a thermometer in your mouth. I wish everybody had the scan ones. That's very stressful. Being able to communicate if you feel like somebody doesn't have gloves on, you please ask them to put on gloves, reminding them to put on masks. I don't think that's happening in the hospital so much, but knowing that it's your right to ask somebody to do that. Worries of having a reaction, being alone, that's definitely been hard for sure. Is this one? Well, I seem to have lost my presentation. So Felix, can I put another one up real quick? Should I stop share? I don't see you guys. Okay. Okay. Sorry, everyone. There was a little mix up with my slides, but in any event, I think that the gist is there. That of all the things that I talked about with the gratitude and acceptance and self-awareness, to really remember and be grateful for what we do have daily. I know when my beginning of the pandemic, my husband was sick for 2 weeks, and he was quarantined, and we couldn't be with him or anything. And then he was, thank goodness, negative test and fine after that. But I think I really realized what gratitude meant at that point, because we'd never been in a situation like that. So now we can actually be with your family is so special. So I hope this was good information. I'm going to go to Kia now and have Kia talk to you just a little bit about her hospital experience and what she sees happening with some of the kids at the hospital and the parents, and just she can give us some little golden nuggets to walk away with.
Myself. good pause there. Welcome back. I'm so sorry. I'm Kia. For those of you who are just joining for whatever reason, I'm a certified child life specialist. And Kathleen invited me here to talk about any type of kind of stress or stress management, mindfulness techniques that you can practice. Of course, Kathleen maybe mentioned some that you could do at work, at home, at school. But bringing in the kids a little bit just to understand, maybe as a caregiver, or maybe you're a child and you're on a pediatric unit one day, or you're somewhere at home, just a way that families can do stress management tips together. And there's some unique ways that have worked for kiddos that I've worked with on my pediatric unit for almost 10 years. And then some things that doctors and nurses and a lot of parents have told me work too. So I have a few of them. Number one, and I'm sorry if I'm repeating Kathleen, but we're kind of on the same page. So I know she's mentioned a few, I will here too. But one is making sure that you have someone on your side when you're on that unit, right? Or when you're in the hospital. So that could be a social worker. If you're in pediatrics, that could be a certified child life specialist. Me, I'm in Chicago, but if you're ever here, ask for me. But there should be certified child life specialists on a pediatric unit. So if you're a parent or a caregiver or extended family member that's taking care of kiddos in a hospital, it doesn't even have to be a hospital. It could be an emergency room. It could be an outpatient clinic. We're in dentist's office now, or a social worker. They're the best. They're the ones that kind of help you through this so that it helps your heart, it helps your mind, it helps whatever spirit, religion, whatever you are. These are the type of people that meet you where you're at. So if you meet a child life specialist in pediatrics or an adult setting, ask for a social worker. And if there are other mental health issues, a psychologist. Make sure to understand that there's definitely some sort of coordinator that's going to help you kind of with any type of stress management that you need. I wish I could say that I worked in an adult setting and can give you more tips there, but I'm going to kind of transition to pediatrics a little bit, if that's okay, Kathleen.
Yeah.
For kids themselves, right? Like, I know as a kid, if I was on a pediatric unit or a children's hospital, and I'm sitting around and I'm waiting for maybe a blood transfusion, or maybe a nurse is going to give me an IV, or maybe a poke or an injection, they call it, I can maybe get kind of nervous, right? And so I might look around and think about what I could use to help me take a deep breath. And this is for parents too. Sometimes it's nice to see your mom and dad do this, right? So I just say, remind your mom or dad, or you, if you're the kid listening, to take really, really deep breaths before anything happens. And just, for me, it's really hard to calm down sometimes because I like thinking about a lot of things, right? So as a kid, I know how that feels. Sometimes you're thinking about mom or dad or school or my friends, or I miss this, or I want the iPad or a computer. I want something that helps me calm down. But if we are alone, maybe in a hospital setting, or we're with mom or dad and something scary is happening, the best thing you could do is just take a deep breath. No matter how fast you're going or how slow you're going, it is really good to just go. So if you're a kid over there or a caregiver, doesn't matter how old you are, or maybe you're a grandma or grandpa, just take a deep breath with me, because virtual conferences, there's a lot of information and we're giving so much information that you have to listen to. So we could just all take a deep breath together. We'll practice that and I'll give you a couple more tips and then I'll let you go. Neat that you could do that digitally. Let's try that one more time. All right, so now that you're in a hospital setting or in a healthcare setting and you have somebody on your side, you found a social worker, certified child life specialist, remember that a nurse and a doctor, those are really important parts of your care, right? So recognizing, hey, I know in the midst of everything that's going on, everybody's in a really high stress level maybe, and there might be nurses that are as well, and trying to find a nurse that is a good fit. And it's always okay to ask for whatever you need. And it doesn't hurt to say, hey, I need an extra cup of coffee, or I need an extra this or that. It's the little things that sometimes the nurses kind of want to know too how you're feeling and what they can bring you. They'll get to know you a little bit better if I like to use the word explicit, that you're open and honest and you're able to say, hey, I need something to make me feel better in this moment, okay? Some other things are, how can you connect digitally? Many of you might be doing that, but some of you might not, and that's okay. But thinking of your iPad, let me find an iPad here. Do I have one? Oh no, you know what? I don't have an iPad. Okay, what else can I use? Do I have a phone? Maybe. I think my phone might work. There might be an app. You heard of the app? I actually just started learning about an iPhone, believe it or not. I had a flip one. But you can download an app called, I think it's like an app store or something. And there might be a few apps there that can help you connect with your family digitally and safely. The social worker and the child life specialist might know how to do that and how to help you connect with others outside of the hospital setting. Because sometimes it's kind of lonely. And sometimes you just need your friend Turner or Fred or your grandma, and you really need to kind of connect with your grandkids, right? So there might be an app that someone can help you in the healthcare setting to download to connect to other people safely. Police Anemia Foundation might know some of those, and we'll figure it out together if they don't. But somebody hopefully can help you in that setting. And last but not least, think of things that help you at home that you can bring inside the hospital setting. Maybe it's an emergency and you don't have them, but maybe you can ask your nurses, but what are things that you can calm down with? Maybe it's an essential oil, maybe it's music, maybe it's just asking kindly if there's a white noise machine. I know that these are all a lot of privileges on a unit. I hope that everybody can have access to a fan or some sort of white noise. That would be great. Sometimes just blocking out sounds, blocking out the beep beeps and the medical terminology. It's kind of nice to just even out that jargon and just make your zone. Last but not least, make your zone. That's what I call it. You are in charge of that space. You're going through a lot thinking about diseases, the illnesses and the germs and the coronavirus and the COVID and the 18 and 14 and 13 and everything that's going on. And it's a lot of information. So I say make your zone, whether it's texting somebody or writing it down, keeping your thoughts not just up here because that's a lot. Right? Like your coffee just kind of spills over a little bit. So just write all notes and things that you want to ask the doctors. That gives you a lot of power. Your notes and your thoughts have so much power, whoever you are. Put them down somewhere, right? And then create the zone with the music and the essential oils or whatever calms you down. Maybe it's something religious. Maybe it's something that you've given permission and your kids can put on the wall. Maybe it's a poster of their latest Pokemon show, whatever it is. Making it your zone, and the nurses and doctors want you to do that, I hope. So thank you so much for listening to me. Hopefully you can find yourself finding some stress care and self-care in that moment, wherever you are. Thank you for listening, and I'll hand it over to Kathleen.
Thank you, Kia. I appreciate it. Thanks, everyone.